interested in a couple of the statistics that came up. One was that a huge disparity between the variables from India, this reported level of social violence in terms of arrest and other antisocial behaviour, and the correlation between that and the actual level of violence in India, which was apparently very, very high. And I'm wondering what that disparity was about. And I'm also wondering if, looking at the various countries that you were examining, the question of the worldview didn't seem to arise at any level in the number of the variables that you were relating. And I'm particularly interested to know whether the worldview in India, which does have a greater gender diversity than the predominantly monotheistic religions of Judaism, Christianity, or Islam, had any effect on the kind of gender violence that was experienced. And also I'm wondering why you might not have included any of the matriarchal societies where gender violence is extremely low, and why that isn't part of your variable.
Do you want to take a few questions together, Gary? Is that okay? And so we'll go here, and then we'll go there, and then we'll see what happens.
Hi, I'm Roisin Gallagher from Concern. I just had a couple of questions, and thanks for the great presentations. When you mentioned about young men and different factors, and you mentioned high rates of depression, I'm just wondering about suicide. We never really hear about suicide. We hear it in Western world more so, and high rates of marginalised groups. I'm just wondering if you came across suicide. And then you talked about ex-combatants and the high levels of young boys who had been combatants, and they were frustrated in their violence afterwards. Did you have any research on girls who were combatants and their levels of violence afterwards? And then lastly, you had a slide on men were asked about policy and if they would want quotas for government. And Rwanda didn't feature in that, and I'm just wondering, I'd be curious, because Rwanda has one of the highest levels of women as government representatives, to hear the men's views on that. Thank you.
Thank you.
Melanie Hoover, UCD Dublin. I just have two quick questions. Well, first, you mentioned already the data in Mexico quite surprised me, because we have done some research which I think is a little bit contradictory, but you were mentioning already that there might be kind of a problem with the data gathering. But another question on the Mexico issue would be the view on impunity. I was wondering if there has been, if that has been included. Because if we look at the drug war, the drug problems, and also the Maras Salvatruchas, etc., big problems for Central America, I suppose the view of violence, what is being seen as violent and as illegal action or criminal action, might be a little bit different than in other parts of Latin America, of the world maybe. And then the second question would be regards your cohort. I was wondering, you were mentioning that you were looking mainly at urban, was it? Urban backgrounds in most countries. But I was also wondering if you could give any information on ethnic and class background of your cohort. Thank you.
On the first question of, India does stand out for the fact that particularly the Latin American countries had high rates of men, and Croatia, I would suppose it was also there, high rates of violence overall, that is men's violence against other men, participation in robbery, etc., but not as high rates of intimate partner violence as India and Rwanda had. Rwanda seems to have not quite as low of public violence rates as India does, but it's close to that direction. I think there's some theory or some hypothesis making to be done there. One, we might say that the way that power structures work and again, this is two cities in India. India is a universe apart. So this is Vijayawada in the state of Tamil Nadu and Delhi. So we are, again, I should offer the caveat that I'm using country names. The only one that is truly a nationally representative country sample is Rwanda. All the others need to be taken as the two cities where they were carried out. So in those two cities in India, being more specific there, we could make some hypothesis about that power structures hold other men's violence in check, and there's either some kind of more powerful men who don't let you get away with those things, but there's nothing that keeps you from not using violence against women, let's say, or there's a lot less of those social controls. But I think there is something to be teased out there. Whereas in other settings, you could say we could make a theory that in urban Mexico, urban Brazil, where we carried this out, urban Chile, there's cultures of violence, let's say, where the things go together. There's impunity around lots of things going on. Again, each one of those is a setting, and I'll come to the point about Mexico as well, but I think it's a good observation. The issue of worldview is a tough one to get in a household survey that you want to be as standard as possible. I didn't mention that there are two other pieces of this project. It sits within a broader project called the Men and Gender Equality Policy Project, where in 6 of the countries we also did a review of existing gender equality policies and how much they discuss or include some reflections around men and masculinities. That's available in a publication that's on the ICRW website. There's a second study called the Men Who Care Study, a qualitative study, where we're interested and we've identified men who are doing more than kind of the average care work, either at home, in terms of home roles of providing care for children or others, or they're involved in caregiving professions that are not the norm for men in their settings. So we're getting some of those worldview questions in that qualitative, as well as, of course, other research. So I think the worldview is a tough one that in a household survey that tries to ask the questions as close as possible in each setting the same way, we kind of end up only touching on the edge of that. On the question, though, of we thought that perhaps India would have less, I didn't present the data on homophobia. We asked a number of questions about that. We thought that India, because of this less dualistic, bipolar view of either this or that we have in the West, that Indian men might be less homophobic. The way that we asked the questions, Indian men were more homophobic than many other settings. So it could be, we're not quite sure what that means. Is it because that question doesn't capture, or is it because the constructions of Indian sexuality don't match with the categories that we use and used in terms of constructing the questionnaire? I don't know. We can talk about that during coffee. But my colleagues in India are thinking a lot about that one as well. The question about and matriarchal societies. It's an excellent question. We'll talk about that at the coffee as well, because I think it would be an interesting one this will be carried out in an additional 5 countries in Asia, and I was trying to think very quickly, but I'll have to have more caffeine to think whether any of those would fit into that category. But I think it is an interesting one to delve more into. Suicide ideation and depression, I think that was you who asked that question. We do have a number of questions there. I didn't present it here. It is quite high. Highest was in Croatia. High association between economic stress and suicide ideation or depression. But Croatia was not the only one that was high, so it is, the full publication that will be available as of next week has some slides about that. And it is a significant issue. When we compared men's rates and women's rates, the men's rates of suicide ideation were higher. The main difference in terms of depression was that men don't seek help and women do. Striking differences there of that. Alcohol use, we've also got data on men's use significantly higher in all the countries. So the full report has a lot of that data as well. The question about girl combatants and also about Rwandan policies. Rwanda did a shorter questionnaire. They learned from our excesses of doing too long of a one. And so where I didn't present Rwanda data, it meant that the question wasn't asked there. So they did a filtering of which they thought were the most important ones to ask. So unfortunately, we lose some of the data that way. We've not yet done the thorough analysis of the women's data. We're presenting the men's data first, but we've not yet done. In the final report, and where you saw me compare women and men on just one of the slides, the report that comes out next week, we are comparing a lot of men's responses with women's, but a full analysis of women's data will come out later on this year, including the question of women affected by conflict in Rwanda. The question about Mexico, I think excellent one. Mexico and Brazil were the 2 toughest places to carry this out, particularly because knocking on doors is seen as a challenge. Brazil has troubles every year doing the census, particularly in low-income neighborhoods, and even more trouble in middle-income neighborhoods who don't want people knocking on the door. Men in Mexico were concerned that if we asked them about violence or even letting people in the door because of this wave of violence going on, that somebody was going to get your information, data, they were going to rob you. We had lots of negotiation and a lower response rate because of that. We're not sure if that also influenced, or we're sure it influenced. We're just not sure in what directions it influenced men's responses. But clearly there was a difference between this kind of law and order mentality, we need to clamp down on this violence, and a sense of impunity about men's use of violence against women. That's one kind of violence and this is another kind. So it's clear to us that men had far different views about those forms of violences. The law and order approach did not apply when they thought about intimate partner violence, at least as we read this data and some of the qualitative responses that we've heard as well. The full report we do have some of issues of, we report on ethnicity, income. We do have reasonably representative samples for their cities in terms of covering the different social strata. So that does come out. The sample sizes were big enough. I didn't report what they were, but they were large enough to cover that, and they were standard household sampling techniques. So we do have the different income strata. We're not reporting on differences by ethnicity. Those are inflammatory things to report on in some parts of the world. We have them, but we're not reporting on them for what to us are appropriate reasons. So I think that was yeah.
Just a quick question and a comment.
Introduce yourself and take
Okay, all right. My name is Nobuhle from Akiba. Just based on your slide on sexual violence. Now the question is, maybe I'll talk in relation to Rwanda. When you're conducting the research, where the definition of sexual violence was given to the women or to the respondents, or to them understand what you're talking about, and then secondly, when I was working with women, in particular African women with domestic violence, issues of sexual violence, the discussion did come up, but then now the issue was when a man and a woman are married or when they are living together, in the African context, the issue of sexual violence or rape per se does not exist.
Yeah.
So now, based on that, I'm just kind of, I'm finding your findings quite interesting, because this was in Africa and then yet it's here.
Yeah.
Women are living in Ireland and yet they have issues, with their rape within a marriage. And actually one of them said that in her language there's nothing like rape within a marriage. Yeah. So just, kind of interested on that side.
Our Rwandan colleagues didn't ask that question because they didn't think it would be understood. So we used, in terms of the language that was used, we did do pre-testing in every country, and we did the double back translation to see if we were getting as close to a definition in each language. So did the same in Kenya, Rwanda, to see if the language we were using was understood when we pre-tested it with women and with men, and if it matched as closely as is possible with all the stuff that's lost in translation, but did it seem to match the definitions that we were using in the other languages? We used the standard WHO definitions that were used in the multi-country study, and we were also inspired a lot by a study that Rachel Jukes and colleagues did with the Medical Research Council in South Africa of their study on men and sexual violence. The methodology was used to, the question was typically asked in a how many times have you? So in a sense it was asked in an affirmative, you had to negate that you had done that. And Rachel and colleagues in testing this in South Africa found that was an easier way to kind of push away the taboo that's often that men would have about reporting this. And it is in line with the way that the coordinators of the WHO multi-country study also asked it. We never used the word violence. We asked them about different acts that we define as violence, but it was pushing, slapping, how many times have you forced? So there were other words used, and so there was enough words used that I think we captured a lot of the violence, but you're absolutely right that the one of marital rape didn't translate, at least in the one sub-Saharan African context that we included, and our Rwandan colleagues decided not to include that as a question.